Here we have the body in anatomical position. An incision has been made from the jugular notch to the xiphoid process. The skin will now be reflected. On the left, we see subcutaneous fat, which I will now reflect. Pectoralis major muscle is seen on the left as well as the right. On the left, we see the clavicular head of pec major attaching to the clavicle. We also see the sternal head of pec major attaching to the sternum. Pectoralis major will now be reflected. Deep to pec major is pec minor. The medial pectoral nerve is visualized here, innervating pec minor as well as pec major. The pectoral branch of the thoracoacromial trunk is seen here, and the thoracoacromial trunk stems from the axillary artery. I will now reflect pectoralis minor. The thoracic cavity will now be explored. We cut the sternum from the manubrium to the xiphoid process. Before looking at the thoracic cavity, let's take a look at the intercostal muscles. Intercostal muscles come in three types: external, internal, and innermost. The types can be identified based on the muscle fiber orientation. Here's an example of external intercostal muscles. These muscles are identified by hands in the pocket muscle fiber orientation. These muscles aid in forced inspiration. Here are internal intercostal muscles. These muscle fibers run in a hands to the heart orientation. Deep to these are the innermost intercostal muscles. Both of these groups of muscles aid in forced expiration. Let's reflect the rib cage and take a look at the thoracic cavity. Before we look at the main contents of the thoracic cavity, like the lungs and the mediastinum and its contents, let's look at the vasculature that perfuses the rib cage. Here we have the internal thoracic artery, which branches off of the subclavian artery. The internal thoracic artery runs in the posterior aspect of the rib cage. As it descends, it gives off anterior intercostal arteries. The anterior intercostal arteries run with anterior intercostal veins and nerves in neurovascular bundles. The anterior intercostal arteries anastomose with posterior intercostal arteries, which will be dissected and described later. Returning to the thoracic cavity, we see the left and the right lung. Reflecting these laterally, we see the mediastinum, which is a central compartment of the thoracic cavity. It contains many of the important structures apart from the two lungs. Inside the mediastinum, we see the heart here, encased in its fibrous pericardium. Separating the thoracic cavity from the abdominal cavity, we see the diaphragm here on the right, as well as here on the left. Let's now take a closer look at the lungs. Welcome back. In this portion of the video series, we'll talk about the lungs. We'll start with a discussion of a brief overview of the anatomical features of the lungs. We'll then discuss the hilum in some detail, and we'll finish with some clinical correlates. We have removed the lungs from the body donor. We see here the right lung. Both lungs are encased in a pleura. The pleura is a membrane that has two parts. The inner membrane is the visceral pleura, and that sits directly on top of the lung tissue. The outer membrane is the parietal pleura, and that attaches to the inner surface of the thoracic cavity. Between the visceral and parietal pleura is the pleural cavity. Let's discuss how the lung sits in the body. You can identify the superior aspect of the right lung here. It's identifiable because it's apical, and this is in fact the apex of the right lung. Here we have the inferior border of the right lung, and this is its diaphragmatic surface. Here we see the right lung's posterior border, and here is its anterior border. Therefore, the right lung sits in the body like this. The right lung has three lobes. We see here its inferior lobe, here its middle lobe, and here its superior lobe. The right lung has two fissures, the oblique fissure here, and the horizontal fissure here. On On the medial aspect of the right lung, we see its hilum here. Let's now talk about the left lung. This is the apex of the left lung. We have its inferior border here, its anterior border here, and its posterior border here. Therefore, the left lung sits in the body like this. The left lung only has two lobes. Its inferior lobe here, and its superior lobe here. The left lung only has one fissure, the oblique fissure, seen here. Unique to the left lung is the lingula, seen here. On the medial surface of the left lung, we can observe the cardiac notch here. This is the hilum of the left lung. Let's now talk about the hilum in slightly more detail. Okay, so here we have the hilum of the right lung. Let's talk about how to identify the important structures of the hilum with the use of the popular mnemonic RALS, R-A-L-S. I've drawn out the mnemonic here. It stands for right anterior, left superior. Here's a diagram of the medial view of the right lung. This direction is anterior, this is posterior, superior, and inferior. The way the mnemonic works is it describes the location of the pulmonary artery, here in blue, in relation to the bronchus, here in black. So this pulmonary artery is anterior to this bronchus, therefore one can say that this is the right lung. These structures here are pulmonary veins, and this is a bronchial artery. Moving on to this other diagram, we have a similar medial view of the lung, with posterior in this direction, anterior, superior, and inferior in this direction. Here we see the blue pulmonary artery located superior to the bronchus. Therefore, one can say that this is the left lung, because left is superior. These are pulmonary veins, and here is the bronchial artery. So let's see how this looks in an actual lung. Going back to our lung here, we see the hilum. This structure here is very cartilaginous, you can see that. So this is most likely the bronchus. And then we see here a vessel with a thick wall, so this is probably a pulmonary artery. Therefore, this pulmonary artery is anterior to this bronchus, so this must be the right lung. And here we see a pulmonary vein. And in between the pulmonary artery and bronchus, we see the small bronchial artery, which most likely will not be visualized on video. Going on to the left lung, we see the hilum here. This cartilaginous structure is a bronchus, and this thick-walled vessel is an artery. Here, the artery is superior to the bronchus, therefore this must be the left lung. And here we see pulmonary veins, and a bronchial artery is located here between the bronchus and the pulmonary artery, which can be visualized in person or perhaps through pictures in an atlas. That takes care of our discussion of the hilum. Let's now move on to some clinical correlates for the lungs. Okay, let's talk about some clinical correlates for the lungs. Aspiration is a common topic on the USMLE. I have here a model which will help us understand aspiration. The trachea is seen here, giving off the right main bronchus, as well as the left main bronchus. As you can see, the right main bronchus comes off at a steeper angle than does the left main bronchus. For that reason, something that's aspirated is more likely to travel down the trachea and wind up in the right lung. Let's take a look at an actual right lung, because it has certain areas in which a physician is more likely to find an aspirated item. In a hypothetical situation, a person is standing and aspirates a peanut. Their lung would be in this position. That peanut is likely to travel and end up in the basilar segment of the inferior lobe here. Alternatively, we can take a look at a hypothetical situation in which a person is supine. The lung would be like this. That person aspirates a peanut. It's likely to end up in one of two locations. One location is the superior segment of the inferior lobe here. Another location is the posterior segment of the superior lobe here. These two areas are the most gravity-dependent areas of the lung while a person is supine. That completes our clinical correlate discussion for the lung. Let's now take a look at the heart.